The treatment of breast cancer depends on the stage and the grade of the breast cancer. When you are diagnosed of breast cancer, your doctor will stage, and then the tissue that was taken to the lab, the result when it comes out comes with a grade. So with the staging, we have the TNM staging. The T will talk about the size of the cancer, the N talks about lymph node involvement, and M talks about metastasis, meaning whether it has spread or not. So based on the extent of all of these put together with the grade, then the doctor will determine how you are supposed to be treated. When it comes to the treatment, we have surgical, we have chemotherapy, radiotherapy, and hormonal therapy. So for the surgical, that is, basically surgery. So for the surgery, it can just be a removal of a lump. It can just be a part of your breast or a whole of your breast. For the chemotherapy, we have adjuvant and neoadjuvant. Neoadjuvant means that we do the chemo. Chemo is just simply means you're giving you some medication, some chemicals to kill the cancer cells. If we give it to you before a surgery, it's neoadjuvant. The idea is to make it smaller, to make the cancer cells smaller so that the surgery will be easier and not too extensive. When it is after the adjuvant, that means we do the surgery before we give the chemo. That way, it is to target those cells that have left the breast and gone to other parts of the bodies that the surgery cannot target. Now we come to radiotherapy. We use this radiation, either targeted to destroy the cancer cells as well. And we have hormonal therapy. So the cancer cells express certain hormones. So we have the HER2, estrogen, and progesterone. Based on which one you express, which will be seen on your histology report, the doctors will also decide whether the kind of medication, hormonal therapy they would give you. So we have these 4 modalities, and then based on your stage and your grade, your doctor will see which one is appropriate or which combination is appropriate to give you a better outcome.